Are you considering taking Premarin and want to know more about its potential side effects? Look no further. In this article, we will provide you with comprehensive information on the potential side effects of Premarin, ensuring that you are fully informed before making any decisions. Premarin is a commonly prescribed medication for hormonal imbalance and menopausal symptoms. While it can be beneficial for many women, it is important to understand the potential risks. We will discuss both common and rare side effects, allowing you to anticipate and recognize any adverse reactions. From nausea and dizziness to more serious concerns such as blood clots and stroke, we will outline the different side effects you should be aware of. It is crucial to consult with your healthcare professional before starting or stopping any medication, as they will be able to provide personalized advice based on your specific situation. Stay tuned for this insightful video, where we will walk you through the potential side effects of Premarin and give you the knowledge you need to make informed decisions about your health and well-being. What is Premarin? Premarin, short for pregnant mare's urine, is a medication that contains a mixture of estrogen hormones derived from the urine of pregnant mares. It is commonly prescribed to treat symptoms of hormonal imbalance and menopause, such as hot flashes, vaginal dryness, and night sweats. Premarin works by supplementing the body with estrogen, which can help alleviate these uncomfortable symptoms. Premarin comes in different forms, including pills, creams, and injection. The dosage and duration of treatment will vary depending on the individual and the specific condition being treated. It is important to follow your healthcare provider's instructions carefully and not to exceed the prescribed dose. While Premarin can provide relief for many women, it is essential to be aware of its potential side effects. Like any medication, Premarin can cause both common and rare adverse reactions. Being informed about these potential risks will help you make educated decisions about your health and well-being. Common uses of Premarin. Premarin is primarily used to relieve menopausal symptoms, such as hot flashes, night sweats, and vaginal dryness. These symptoms can be uncomfortable and disruptive to daily life. By supplementing the body with estrogen, Premarin helps regulate hormone levels and alleviate these symptoms, improving overall quality of life for many women. In addition to menopausal symptoms, Premarin may also be prescribed to treat other conditions related to hormonal imbalance. For example, it can be used to manage certain types of cancers that are hormone sensitive, such as breast or prostate cancer. Premarin may also be recommended for individuals who have undergone a hysterectomy to prevent bone loss and reduce the risk of osteoporosis. However, it is important to note that Premarin is not suitable for everyone. Individuals with a history of certain medical conditions, such as blood clots, liver disease, or breast cancer, may be advised against using Premarin due to increased risks. Your healthcare provider will assess your specific situation and medical history to determine whether Premarin is a suitable treatment option for you. Potential side effects of Premarin. Like any medication, Premarin can cause side effects. While not everyone will experience these side effects, it is crucial to be aware of them and to seek medical attention if they occur. Common side effects of Premarin may include nausea and vomiting. Some individuals may experience gastrointestinal discomfort, including nausea and vomiting, shortly after taking Premarin. These side effects are typically mild and transient, but if they persist or worsen, it is important to consult your healthcare provider. Breast tenderness. Premarin can cause breast tenderness or swelling. This side effect may be uncomfortable but is generally not a cause for concern. However, if you notice any lumps or changes in your breasts, it is important to seek medical attention, as these could be signs of a more serious condition. Headache. Some individuals may experience headaches while taking Premarin. These headaches are usually mild and temporary. However, if you experience severe or persistent headaches, it is important to consult your healthcare provider. Dizziness. Premarin can cause dizziness or lightheadedness, especially when standing up quickly. It is important to take precautions to prevent falls and accidents, such as standing up slowly and holding onto stable objects for support. While these common side effects are generally mild and temporary, there are also more serious side effects associated with Premarin that require immediate medical attention. These include blood clots. Premarin can increase the risk of blood clots, which can be life-threatening. Symptoms of a blood clot may include sudden severe leg pain, swelling, warmth or redness, chest pain, shortness of breath, or sudden severe headache. If you experience any of these symptoms, seek medical attention immediately. Stroke. Premarin may increase the risk of stroke, especially in individuals with certain risk factors, such as smoking, high blood pressure, or a history of cardiovascular disease. Symptoms of a stroke may include sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, sudden severe headache, or loss of balance or coordination. If you experience any of these symptoms, seek emergency medical care. Endometrial cancer. Premarin can increase the risk of developing endometrial cancer, especially when used without a progestin hormone. It is important to discuss the risks and benefits of Premarin with your healthcare provider, especially if you have a history of endometrial cancer or abnormal uterine bleeding. These are just a few examples of the potential side effects of Premarin. It is important to consult with your healthcare provider for a comprehensive list of possible side effects and to discuss any concerns or questions you may have. Precautions and warnings for using Premarin. Before starting Premarin, it is important to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking. This will help your healthcare provider determine if Premarin is a safe and suitable treatment option for you. There are certain precautions and warnings associated with Premarin use that you should be aware of. These include increased risk of certain cancers. Premarin can increase the risk of developing certain types of cancers, such as breast and ovarian cancer. It is important to discuss your personal risk factors with your healthcare provider and to undergo regular screenings as recommended. Hormone-sensitive conditions. Premarin can worsen hormone-sensitive conditions, such as certain types of cancers or endometriosis. Your healthcare provider will assess your specific situation and determine whether Premarin is a suitable treatment option for you. Interactions with other medications. Premarin may interact with other medications, such as blood thinners or certain antibiotics. It is important to inform your healthcare provider about all medications you are currently taking to avoid potential interactions. Limited effectiveness for certain symptoms. While Premarin can be effective for relieving menopausal symptoms, it may not provide relief for all symptoms. It is important to discuss your specific symptoms with your healthcare provider to determine the most appropriate treatment plan for you. By being aware of these precautions and warnings, you can make informed decisions about whether Premarin is the right treatment option for you. Long-term risks associated with Premarin use. Using Premarin for an extended period of time may carry certain long-term risks. Some studies have suggested an increased risk of cardiovascular disease, including heart attacks and strokes, in individuals using estrogen-based hormone replacement therapy, HRT, like Premarin. The risk appears to be higher in older individuals who start HRT several years after menopause. It is important to note that the decision to use Premarin or any other form of HRT should be individualized and based on a thorough assessment of the potential risks and benefits for each individual. Your healthcare provider will consider factors such as your age, medical history, and overall health to determine whether the benefits of using Premarin outweigh the potential risks. If you are considering long-term use of Premarin or any other form of HRT, it is important to have regular checkups and to discuss any concerns or changes in your health with your healthcare provider. Regular monitoring can help identify any potential complications or adverse effects early on. Alternatives to Premarin. If you are concerned about the potential side effects or risks associated with Premarin, there are alternative treatment options available. Your healthcare provider can discuss these alternatives with you and help determine the most suitable treatment plan based on your individual needs and preferences. Non-hormonal therapies. Non-hormonal therapies, such as lifestyle modifications, dietary changes, and over-the-counter remedies, may be effective in relieving menopausal symptoms for some individuals. These therapies focus on managing symptoms through natural means without the use of hormonal medications. Progestin-only therapies. For individuals who require estrogen replacement therapy but are at a higher risk of developing endometrial cancer, progestin-only therapies may be an alternative to Premarin. Progestin is a synthetic form of the hormone progesterone and can be used in combination with estrogen to provide relief from menopausal symptoms while reducing the risk of endometrial cancer. Bioidentical hormone replacement therapy, BHRT. BHRT uses hormones that are structurally identical to those naturally produced by the body. These hormones are derived from plant sources and are believed to have a more natural and safer profile compared to synthetic hormones like Premarin. BHRT can be customized to an individual's specific needs, providing a personalized approach to hormone replacement therapy. Discussing these alternatives with your healthcare provider will help you make an informed decision about the most appropriate treatment option for you. How to minimize the side effects of Premarin. While it may not be possible to completely eliminate the risk of side effects when taking Premarin, there are steps you can take to minimize their occurrence or severity. Here are some tips to consider. Follow your healthcare provider's instructions. It is important to take Premarin exactly as prescribed by your healthcare provider. Do not exceed the recommended dose or change the dosing schedule without consulting your healthcare provider. Report any side effects. If you experience any side effects while taking Premarin, it is important to report them to your healthcare provider. They can assess the severity of the side effects and determine whether any adjustments to your treatment plan are necessary. Stay informed. Keep yourself informed about the potential side effects of Premarin and be aware of any changes in your health. Regular checkups and open communication with your healthcare provider can help identify and address any potential issues early on. Lead a healthy lifestyle. Adopting a healthy lifestyle can help minimize the risk of certain side effects associated with Premarin. This includes maintaining a balanced diet, engaging in regular physical activity, avoiding smoking, and managing stress. By following these tips, you can help minimize the potential side effects of Premarin and promote your overall well-being. Talking to your healthcare provider about Premarin. Before starting or stopping any medication, including Premarin, it is important to consult with your healthcare provider. They will be able to assess your specific situation, provide personalized advice, and address any concerns or questions you may have. During your consultation, consider asking the following questions. What are the potential benefits and risks of taking Premarin for my specific condition? Are there any alternative treatment options I should consider? How long should I expect to take Premarin? What are the signs and symptoms of potential side effects or complications that I should watch out for? Are there any lifestyle modifications or precautions I should take while using Premarin? How often should I have checkups or follow-up appointments to monitor my progress? Open and honest communication with your healthcare provider is key in making informed decisions about your health. Legal considerations regarding Premarin use. It is important to note that Premarin is a prescription medication and should only be used under the guidance of a healthcare professional. Using or obtaining Premarin without a valid prescription is illegal and potentially dangerous. If you have any concerns or questions about the legality of obtaining or using Premarin, consult with your healthcare provider or a trusted pharmacist. They can provide guidance and ensure that you are accessing the medication safely and legally. Conclusion. Making an informed decision about Premarin use. Understanding the potential side effects of Premarin is crucial for making informed decisions about your health and well-being. While Premarin can be an effective treatment for menopausal symptoms and hormonal imbalance, it is important to weigh the potential risks against the benefits. By being aware of the potential side effects, precautions, and alternative treatment options, you can have open and informed discussions with your healthcare provider. Together, you can determine whether Premarin is the right treatment option for you or if there are alternative approaches that may be more suitable. Remember, your healthcare provider is your best resource for personalized advice and guidance. They can help you navigate the complexities of Premarin and ensure that your treatment plan aligns with your unique needs and goals. Thanks for watching.